Governor Holcomb's briefing will begin in 2 minutes. For the journalists joining us in the digital press room, if you'd like to ask a question, you can click the Raise Your Hand button. When your name is called upon, we will unmute your microphone, and then you also will have to unmute your microphone.
Good afternoon, Hoosiers. Thank you for joining us once again. It is Wednesday at 2:30, so we've become accustomed to this, but I want to say at the outset that next week, as we get into the holiday rush for many, we're going to, instead of holding this press conference at 2:30 on Wednesday, we're going to back it up one day. We didn't want a week to go by without giving updates, but we will do it at 2:30, same time, same place, but a day earlier. So on Tuesday, if you would like to join us, just back it up a day. That reminds me also that just as we talked about ad nauseum going into the holidays over Thanksgiving, that period and that long weekend, same true as we approach the end of the year from next week all the way through the new year. We just want to encourage people to continue to properly distance, physically distance, wear a mask when you need to, when you're close to other folks, wash your hands, all those things. And there's light at the end of the tunnel. We're seeing it and you'll give a full report on our vaccination process, which is well underway statewide. But that doesn't mean that we get to relax on the things that have helped us get to this point and will need to continue to do for months and months ahead. And so as the vaccination, and I was just down in Catalent, as you know, down in Bloomington, Indiana, yesterday. They're working with Moderna. They mentioned that they were going to do 20 million doses by the end of this year. So in this December period, and then 100 million in the first quarter and 100 million in the second quarter. Obviously, Catalent has multiple contractual arrangements with others. So, again, it's morning in America. We're looking at the light at the end of the tunnel, but we gotta play this all the way through. And we have different waves, and you and Dr. Weaver can go through that as well, about who, when, where, how that happens. Speaking for myself, I will absolutely get the vaccination, but it won't be until you tell me it's my time. I'm not cutting in line. I'm the furthest thing from a frontline healthcare worker, and we need to make sure those vectors, those folks that are on the front line, and then the high risk. And fortunately, I'm not in that high risk category. You may think I am some days, but I will wait for you to tell me when it's right. But I did want to just say that I'm going to do my part and get vaccinated as well. toward that end, we do have, Rachel, if you could cue up a video that we have underscoring this very point.
Picture, guys.
Fantastic. And with that, we've also got, we'll go right now to Dr. Box, but we've also got Dr. Weaver on hand, Dr. Dan Rosiniak, we've got General Lyles, and we've got Chris Johnston, who's had a busy morning with the revenue forecasts that have come out. And he has given an update on our CARES Act dollars for the remaining part of this year, already thinking about what's going on in Washington, D.C. as well on a potential second infusion of dollars. So with that, Dr. Box, if you'd give us an update.
Thanks,
appreciate
Governor. Good afternoon, Hoosiers. Many of our own staff have been moved to tears, just like I was watching that video when we received reports of the vaccine first hitting our state and first going in arms. And then pictures showing people actually getting it has just been overwhelming to all of us. So it is the light at the end of the tunnel. We are still in the tunnel, but it is the light at the end of the tunnel. This is the largest vaccine effort in the history of the state, in the history of the United States, I would say in the history of the world. It requires an enormous coordination of effort from public health and hospital systems to local health departments and pharmacies and many other entities and clinics that are going to join us along the way. The situation changes weekly, I would say actually almost daily. A week ago, no vaccines had received their emergency use authorization from the FDA. By this weekend, we could have 2 vaccines with their EUA, and other vaccines are in the pipeline. We will update you weekly on this evolving situation. We know you want to know when you'll be able to be vaccinated, but it's hard to project any further. We have the right team in place, working around the clock to ensure that we can administer a vaccine as quickly and as efficiently as possible. I know many Hoosiers just want this pandemic to be over and are eager to receive their vaccine. Please know that we will get it to you as soon as we possibly can. Dr. Weaver will be here to explain more about that process and where we are. My plea to you is not only for patients, but to remember this. While this vaccine is the light at the end of what's been a very long, dark tunnel, it will still be a number of months before we can make vaccine available to every Hoosier who wants it across our state. That means we will still need to wear masks, maintain social distancing, and stay home if you're sick. If you need a reminder of why those steps are important, you need only to look at the color-coded county map that we update every week. Once again, we have no counties in blue or in yellow this week, and 26 are in red. Our cases per 100,000 residents put all 92 counties in red for the 5th consecutive week at a time. Remember that it takes fewer than 10 cases per 100,000 Hoosiers to achieve a blue status, between 10 to 99 cases per 100,000 to be yellow, 100 to 199 cases for orange, and more than 200 cases for red. Currently, none of our counties are below 200 cases per 100,000 residents. Only 3 counties are even below 400 cases per 100,000 residents, and we have 4 counties over 1,000 cases per 100,000 residents. Although these are slightly better than the numbers we saw last week, it does not mean counties can begin behaving as if they're in a lower color. We have talked extensively with our local health departments about when they can move into a lower tier of restriction. Counties that see an improvement from red to orange, for example, need to stay in orange for 2 weeks before they begin adopting less restrictive measures on social gatherings and other recommendations. This is designed to ensure that the cases are moving in a consistently lower direction and that this isn't just a 1-week drop. Our cases remain high, and that continues to stress our hospital systems, which we're worried about a surge on top of a surge. Approximately 3,200 Hoosiers are hospitalized with COVID or COVID-like symptoms. That is down from more than 3,400 on November the 30th when we saw our high point. But those numbers are deceptive and can change quickly, especially when you look at daily hospital admissions. We had 500 people admitted with COVID or COVID-like symptoms on December 7th, our highest number to date in this pandemic. We need Hoosiers to continue to do their part so that we don't create avoidable illnesses that will further fill our hospital beds. We also have had more than 320 deaths reported to us since Sunday, which brings our total confirmed deaths to 6,781. When you add in the more than 300 probable deaths based on the clinical diagnosis, we've lost more than 7,100 Hoosiers from this pandemic this year. That translates to 7,100 heartbroken families who need us all to buckle down and get through these next months. Last week, I mentioned the impact that our shorter contact tracing script is having on our ability to complete interviews. We're still seeing improvements as a result of those changes. The number of cases interviewed grew by another 14% in the last week. Since November the 1st, we've seen an overall increase of 25% in the number of people who have completed an interview based on the number of new cases in a week. We continue to try and increase those numbers and make contact tracing as convenient as possible. To achieve that goal, we will be implementing an online option for people to complete their contact tracing interviews this week. When Hoosiers receive their initial text from contact tracers, it will include a link that is an alternative to calling the phone number. Hoosiers will continue to receive text reminders during the initial 24-hour period. This doesn't mean a person can't still call. And even if a person only partially completes the online interview, their progress will be saved and can be completed over the phone if necessary. Please continue to answer the call or text and complete the interview. This helps us to protect you, your family, and your community. Finally, I want to remind Hoosiers about how to stay safe and protect your loved ones over the holidays. This is a time of year when we traditionally reconnect with family and friends. The CDC has issued updated holiday guidance to help you consider how you can modify your plans to reduce the spread of COVID-19 and keep your loved ones safe. The lowest risk activities, obviously, are celebrating virtually or with members of your own household who are diligent about wearing their masks, washing their hands, and staying home if they're sick. You increase the risk anytime you introduce people from outside your immediate household. That includes your college students who've been away or your grown children or grandchildren who live elsewhere. Be aware of the community levels of COVID-19, not only where you are, but where you're going if you plan to travel. Indoor locations and longer gatherings, as well as the number of people at a gathering, can pose an increased risk during these times. Before engaging in any gatherings, consider how people are behaving not only at the gathering, but before they arrive to the gathering. Have they been wearing their masks consistently? Are they practicing social distancing? And do they wash their hands frequently and stay home if they're sick? Do not host or participate in any person gatherings if you've had symptoms, have been exposed, or have been diagnosed with COVID-19. If you're waiting for COVID-19 results, please don't leave your home. If you've been exposed to someone with COVID-19 in the last 14 days, please don't join in holiday gatherings. Or if you're at increased risk for severe illness from COVID-19, please protect yourself during the holidays. This applies to members of your household as well. If you're an older adult or who have medical conditions that put you at increased risk of severe illness from COVID, or if you live or work with someone with increased risk of severe illness, the CDC recommends that you avoid in-person gatherings with people outside your immediate household. If you're hosting others, require guests to wear masks except when eating or drinking, and that they maintain that 6 feet social distancing. And wear a mask if you're preparing the food or serving food to others who aren't in your household. Other tips include avoid singing or shouting, provide hand sanitizer, and limit contact with commonly touched surfaces or shared items such as serving utensils. It's better to have one person touch the serving spoon. The safest option is to stay home with members of your immediate household, but understand your risks if you do decide to travel. The CDC has all of these tips and more posted on a website, And I think we have the link right here for you. I know this guidance is hard and yet another reminder of all that we have sacrificed in 2020. But I encourage you to get creative and think outside the box for your own family and for all those empty seats around the table this year. I truly believe that 2021 will be better. And now we're pleased to have Dr. Weaver to give us an update on the exciting news about the vaccine we received this week.
Thank you, Dr. Box. Those in the video were my dear colleagues giving and receiving the first doses of COVID-19 vaccine in central Indiana at IU Methodist just a few hours ago. This has been an incredibly exciting week here in Indiana as we saw the first frontline healthcare workers receive their vaccines against COVID-19. As of today, 5 hospitals have received vaccine, and we expect more than 50 sites to have vaccine by the end of the week. This is an incredible blessing for everyone who has been on the front lines in our healthcare systems and long-term care facilities throughout this pandemic. Thank you for taking care of all of us. As a reminder, registration to receive a vaccine at this time is only open to eligible frontline healthcare workers. It's been gratifying to see the overwhelming interest in the vaccine. As of today, more than 46,000 of those eligible people have registered for an appointment, and that number continues to grow. That represents thousands of healthcare professionals who believe the vaccine is safe and effective and who are willing to do everything they can to help us in this pandemic. The registration link has been shared with hospitals to extend to their frontline healthcare personnel, long-term care facilities to extend to their frontline staff, and with our frontline EMS providers. If you work outside these settings, please be patient. Your turn is coming as more vaccine arrives. Launching an operation of this magnitude requires all hands on deck, and it requires us all to be nimble. We will be notified by the federal government of how many doses of vaccine we will receive as we move forward. This is based on the population of our state as well as the availability of the vaccine. This week, for instance, we are allocated 55,575 doses of the Pfizer vaccine. The Moderna vaccine is still under federal review. We hope it receives its emergency use authorization from the FDA this weekend, which will increase the amount of vaccine available to the states. But we will not know final amounts available to Indiana until Moderna receives its EUA and we receive that allocation notice. This is a rapidly evolving situation, and it's why we have focused our initial vaccination efforts on frontline healthcare workers and long-term care facilities. As more vaccine becomes available, we will continue to roll out eligibility to additional populations. The next Centers for Disease Control Advisory Committee on Immunization Practices meeting convenes on this Saturday. As we did in the first round, we will wait to receive CDC recommendations about which populations to prioritize for future allocations of vaccine. We ask Hoosiers to be patient while this process evolves. You will get your turn to receive the vaccine. We continue to work proactively as we wait for the federal government to allocate weekly doses to Indiana. We are planning ahead so that as more doses are available, we stand ready to administer them quickly and have the right infrastructure in place. The Indiana Department of Homeland Security is assisting us in this effort. We also are creating a vaccine data dashboard that we hope to launch in the next few weeks to keep the public informed about how many people have been vaccinated. Our goal is to show both those who are newly vaccinated and those who have completed both doses, with breakdowns by county and other demographics. And finally, once again, we called upon Hoosiers to help, and you have answered. The state asked the Indiana University School of Medicine to train a volunteer army of students who will be on call to administer vaccines. Within 2 weeks, more than 430 medical students and another 200 nursing students had signed up to support this large-scale vaccination effort. Here's what one of the medical students said. For our generation, this is one of the bigger crises that we've faced in our time. Short of enlisting in the military in the midst of a potential world war, this is the next best thing. We can change the tide in something that has affected everyone's life so much. Again, thanks to our partners at the Bowen Center for adding a vaccine volunteer platform to our Hoosier Heroes Reserve workforce. Using the Hoosier Heroes portal found at the link on this slide, the Bowen Center will capture responses and match vaccine volunteers to a volunteer opportunity in their geographic area. Individuals may help with anything from registration to administering vaccine, depending on their qualifications. While we have months to go before the vaccine is widely available, I want to encourage you to start learning about it now. We have a dedicated vaccine website, www.coronavirus.in.gov/vaccine, that includes a lot of information about the vaccine, who's eligible, the FDA review process, and the clinical trials, including the diversity of the volunteers in those trials. Now is the time to learn about the vaccine so that when your turn does come, you can receive the vaccine with confidence.
Thank you, Lindsay, and you both reminded me as you were ticking off our responsible to-do list and framing this, keeping this realistic of Sergeant Joe Friday. Now, the person that you mentioned, Lindsay, won't identify probably with Dragnet, but I'll paraphrase, just the facts, ma'am. That's what we need to make good decisions about the coming weeks and months ahead. And I shared, we had a cabinet meeting earlier this morning, and I had a friend send a verse, actually the song, "Oh Holy Night." And if you listen to that song over the next couple weeks, there's a couple lines in the first verse that says, "A thrill of hope, the weary world rejoices, for yonder breaks a new and glorious morn." And as you were once again describing the light at the end of the tunnel, but we're still in that tunnel, we can see morning out there, and it is full of light. So we just need to follow the facts, deal with the facts as they are presented to us, and we can affect those facts. That's the really encouraging thing, is we have impact, and that can be positive impact on those facts. So with that, Rachel, let's go right to the Q&A. We got a lot of interest, obviously, in this vaccination process.
Lindsay or Doty, the Indianapolis Business Journal.
Afternoon, Lindsay. With us, Lindsay?
We'll circle back to Lindsay.
Okay.
Emily with the Daily Journal.
Afternoon, Emily.
Good afternoon, Governor. So I actually have two questions. My first one is National Guard soldiers and airmen right now are getting vaccines in Franklin. So my question is, why are the National Guard soldiers getting the vaccine before the rest of frontline workers? And is there a plan? My second question is there a plan currently to notify people like essential workers and those with comorbidities that are eligible to get a vaccine when the time comes?
General, you are teed up.
Thank you, sir, and thank you for the question. That's a great question. So Indiana was chosen as one of the first pilot states by the Department of Defense to participate in the COVID-19 vaccination, along with New York. And so our soldiers and airmen are actually performing frontline care worker duties today and have been basically for the last 9 months. So today we start the vaccine, and we will vaccinate all of our soldiers that have volunteered to do that, that are actually out helping in the long-term care facilities and other places.
Lindsay, do you want to, it's kind of a soft shoe routine here, back and forth, but Dr. Weaver, you want to take the second question that Emily had?
Yes, absolutely. So just as before we started vaccinating our healthcare workers, we did a really big push to let them know this is how you're going to get notified. So based on who our next groups are, which again, we are awaiting recommendations from the CDC's ACIP committee to let us know what their recommendations are and who should vaccinate next. We will go ahead and do the same thing, start to notify people. We have already started to tell our healthcare providers that, you know, if this is vulnerable populations, how are we going to work to make sure that we're getting our vulnerable populations, critical infrastructure, making sure that points of contact, that we know who those people are and exactly how we're going to communicate. So on top of that, a big campaign, you know, we have our website, so people can check there, the coronavirus.in.gov/vaccine, where we will continue to update as we expand eligibility to other groups.
Thank you, Lindsay.
We'll go back to Lindsay or Doty.
And to Lindsay, from Lindsay.
Hi, Governor. Sorry about that.
Yep.
Gotta love technology.
I love it.
I believe the state still has about $600 million in CARES Act money that has not been allocated yet. And your administration has repeatedly talked about, wanting that deadline for when the money has to be allocated extended. But you've got about 2 weeks to go now until that deadline. So
Yeah.
it's realistic to keep thinking that that might change. And is there a plan in place for how to allocate that money if the deadline doesn't change? And then you'd also mentioned a potential second infusion of dollars. So I was wondering if you could explain what you meant by that.
Well, yeah, I see Chris on this, Johnston on the screen here. Those you use the absolute appropriate and right word, Lindsay, that those dollars will be allocated, and we have long been pushing for an extension, but we do have a plan that those funds will be obligated and allocated and used here in the state of Indiana. So we're not going to be sending money back or leaving money on the table or wasting or spilling any dollars. We've got it all allocated. Chris, you presented this morning on a CARES Act update. You want to go into a little detail, give a thumbnail sketch of what you presented earlier today? And by the way, Lindsay, what I was referring to is what our partners in Washington, D.C., and Chris, you might touch on this too, but our partners in Washington, D.C. seem to be getting closer and closer and closer to an agreement in the House and the Senate, and something that I hope the president could sign into law, and hopefully that's before Christmas.
That's correct. Thank you, Governor. Earlier today, I made a presentation to update the State Budget Committee on the Coronavirus Relief Fund. And prior to that, Lindsay, you were correct. I mean, there was a roughly $650 million that appeared to be unallocated. We actually announced our commitment today, which was $400 million, at least $400 million would be contributed to the Unemployment Insurance Trust Fund. That trust fund, which pays out unemployment insurance, has been drawn on to the tune of $1.4 billion. And in fact, the state of Indiana is borrowing from the federal government. And so we believe it is prudent to make a deposit to avoid that borrowing. The amount was estimated based on a range of scenarios that were calculated. Again, is probably a pretty
Rosie?
well, no, a volatile, a range of different scenarios as far as the current state, but then also looking at other recessions or previous recessions, as well as more optimistic scenarios. And so the deposit will the goal was to repay that federal loan and what would be anticipated federal borrowings through the springtime. Now, that could change based on the economy. And so if we put that in perspective, that is just really retiring a loan from the federal government. As I said, the trust fund has spent $1.4 billion, and over $1 billion is what the expected balance should be. So that's not even starting to make a deposit as to growing that balance back to where it needs to be, which is what employers have to do when they pay their unemployment, their payroll taxes. The reason this is also important is this is exactly the time we want businesses to be in as best position as possible to rehire and hire new employees as we bounce back out of the recession.
And as you always say, Chris, a forecast is just that. It's a forecast. And fortunately, we'll get another in April, so we'll have an even better idea as these coming months unfold.
If I may, sir,
Yeah.
you asked about the prospects of what happens with the federal government with the legislation that they're considering. And this is something that has been on again, off again for many months. There are what appear to be more promising reports coming out of Washington, D.C. as far as an additional federal assistance package. There are different components, many of them additional funding, a component of extending deadlines to be able to use the money. And so, again, as we've been doing in managing this money for the last 6 months, we take the approach, what we think is the best use possible of this fund based on the best information that we have.
Thank you.
Brandon Smith, Indiana Public Broadcasting.
Afternoon, Brandon.
Afternoon, Governor. My first question probably goes back to Chris. So 650 million left, 400's going to the UI Trust Fund. What about the rest of it? That's my first question.
So one of the things that was mentioned this morning at the State Budget Committee was that there's a program called Local Public Assistance, which a lot of schools are participating in that program. Well, there has been some twists and turns with the ability to get applications approved through that. And so we are thinking that we need to develop a program. Those are costs that the schools have incurred. They've submitted their applications to FEMA, but unfortunately, FEMA is denying several of those applications. I was given a list of about 68 applications, and I believe 60 of them have been denied. So we think that that is something that we need to take a look at and see how we can assist through the Coronavirus Relief Fund. It was our anticipation all along to piggyback on top of that. The FEMA program is a 75-25% program, and so we were always anticipating using the relief fund to pay the 25% local match so that the schools would be made whole. But the process appears to be dragging on, and so we think that this is something that we need to take a look at and possibly develop a program for. As far as the dollar amount, we need to take a look at the applications that are in the queue and see what that dollar amount is. So that would be one significant chunk paring away at that difference that you identified, Brandon. The other is just being able to, we've reconfigured some of our small business programs, and we're hoping that generates some interest in the IADC small business program, and hopefully be prepared to provide even additional assistance after that.
Yeah, because Brandon, it goes right back to what Chris said. We want our businesses to be in a position right now and into the future as they come back online. We got a 5% unemployment rate, but that's, last time I checked, it was about 167,000 Hoosiers. So we want to get people back to work safely, and if these funds can go toward that end, then they're well spent. You had a second question, Brandon?
I did, yeah, thank you.
Yep.
It's kind of to the point Chris just made, but this is for you, Governor, which is we heard this morning in the State Budget Committee from the National Forecaster that a major red flag for Indiana's economy is the number of people who are struggling to pay their mortgages and struggling to pay their rents, and that seems to be increasing. We also know that hundreds, if not thousands, of Hoosier restaurants across the state are in danger of closing very, very, very soon. So what are we going to do with that care? $400 million for the UI Trust Fund. What's the thought about helping those people who are in need right now?
Well, and Chris, you might want to talk about this, but we have moved, I think, Chris, the last time we moved about $4 million into the fund to help people who were facing potential eviction for those who were unable to pay. We still have the ability to move more funding if we need to, and we're looking at what is happening, obviously, in Washington, D.C. about any extension they may have that could also impact us here at home. The restaurants, this is exactly what Chris was getting at. We're looking at restaurants and our hospitality sector and ways that we can help, not just down the stretch, but into the future as well, because they are, and it's not just Indiana, obviously, it's across the country. And we're trying to make sure that in all of our programs that they're a bridge that helps people temporarily stay in the game. And I know how hard it's been. People are, this is a pandemic, and customers are making decisions based on how safe is the environment. And unfortunately, when you have big conventions. They're just not going to happen right now. That's what I talk about every week. Once we get the aircraft back up and full, and we got the #1 airport in North America, but it's severely impacted by the lack of conventions happening. So what kind of programs can we build? Chris just talked about that. Chris, you might want to elaborate a little bit more, but in terms of, Brandon, what you asked specifically with restaurants, that's exactly what we're talking about. How can we build bridges so that folks can get through this next, 6 months of continued tension with this pandemic? Anything to add, Chris?
Yes. So we've talked before about the Paycheck Protection Program, which the federal government initiated earlier in the year, and that was very successful. I think over 70 or 72,000 Indiana businesses participated in that program in totaling, $9 million in loans, forgivable loans.
Billion.
Yeah, or excuse me, billions. I've been
Just
dealing
a
with
matter of zeros.
I've been dealing with too many numbers today, and so over $9 billion. Our small business program we attempted about the same time to complement the PPP program. Obviously, that's coming to an end. As we've talked before, back in the springtime, I think we had a different sort of shelf life that we thought about the pandemic. We now know that this is having not only public health impacts, but then also economic impacts that extend well beyond December 30th. And so looking at the small business programs again to see what can we do going forward, but then also monitoring the federal legislation to be complementary and hitting the markets that they may not hit.
Yeah, and Hoosier homeowners can always apply for assistance from Indiana's Hardest Hit Fund.
The Hardest Hit Fund, and then as you mentioned, so we had a renters assistance program totaling $40 million. We hit that and exhausted that. We told the housing authority just to keep on going, so they're working through their waiting list.
Yeah.
We've allocated another $4 million to try to address that. If there's more need, then we'll deal with that. But again, we're drawing upon that December 30th deadline, and we'll take the proper action to address these issues.
Thanks, Chris.
Meredith with WLFI.
Afternoon, Meredith.
Good afternoon, Governor. My question is concerning Indiana Veterans Home. So one employee says that the Indiana Veterans Home has had an outbreak of COVID cases, and according to the state dashboard, there hasn't been any. She also says the home applied for crisis pay for state staff. This person, along with other colleagues, say that the governor approved crisis pay for agency contracted staff, but denied crisis pay for state staff. My question is, why was that decision made? And also, why does the dashboard show there are no cases when employees are coming forward saying there are?
Have you seen any report?
I might ask Dr. Rosiniak to comment on that. It seems like to me that we did have a case there, but it's been a little bit of time, and I thought we were engaged up there. Dr. Rosiniak may remember better than I do, I'm hoping.
And we can dig into
Yeah,
it
we
further,
can certainly
Meredith,
get the
and
information.
circle back with you directly.
Yeah, we'll probably have to get more of the details. Certainly, we've been in communication with them throughout the pandemic, and I know we've had some infection control preventionists in that facility recently. I think one of the issues could be that as people report cases, there's a lag of about a week from the time that they're going to end up on our long-term care dashboard, and in addition, we've got to verify those submissions. So if they're doing a point of care test, for instance, or any facility that does that and submits a positive, that then needs to be verified within our own data reporting system. So there could just be a delay on that, but we can get back to you with more information.
Yeah, make sure, Rachel, that. Yep.
Andrew Smith, WRTV.
Andrew, good afternoon.
Good afternoon. My question is at the end of the month, the National Guard is supposed to leave the long-term care facilities. Is there any plans to have that extended, or what's the plan to continue helping the long-term care facilities after that?
Yeah, General Lyles, you want to address that, because you have become welcomed with both arms wide open everywhere you are. And so this is working, and it's having a pronounced positive impact. So we'll make those decisions when we need to make them, but generally you just want to talk about the experience overall.
Yes, sir. So absolutely. We have guardsmen in all of the 534 long-term care facilities that are providing administrative support, helping the facilities with wiping down spaces and other things, and really making a difference to support a very fatigued long-term care facility staff. Our plan is to start moving soldiers and airmen out of those facilities on or about the end of December. However, we will keep a small cohort of soldiers and airmen back to help with the most critical facilities that remain and that need help.
Taylor with the State House file.
Good afternoon, Taylor.
Good afternoon, Governor. Good afternoon, Dr. Box.
Hi.
I was just wondering about the new online contact tracing, and I was wondering how much it costs to implement something like that, and how many more people you guys expect to respond, and who exactly is administering the website.
So we actually developed that through our IT people there at the Indiana Department of Health. So it really hasn't contributed to additional costs with our third-party vendor that is doing all the additional calls that are there. I think we're up to about 1,300 contact tracers right now, but most certainly it has been a cost in time for our staff to put that together.
And training more to trace, right? Yeah.
Jody with WRBI Radio.
Hello, Jody. How are you?
Good afternoon, Governor. Can you hear me okay?
Yes, ma'am.
All right. Well, I have two questions for you today.
Okay.
The first, 2 weeks ago, the Baltimore Ravens reported that they had 4 different strains of COVID-19 found in their locker room. If that's true, will the vaccine be similar to the flu vaccine, meaning that the best estimate based on the most prevalent strain is what we will be receiving?
Well, I don't want to act like a doctor. You just want to talk about the vaccine as it's rolling out and the efficacy of it. And I mean, I can give you what I read, but
Sure. And Dr. Weaver may want to come up and address this also. But most certainly, when we look at the vaccine and those strains, different strains are circulating all over the United States and the world. And there have been many, many thousands of people engaged in these studies. And clearly, those individuals that received the vaccine were 95% less likely to end up getting infected with COVID-19. So that is a really good news. Now, some of the vaccines are different than others. Some of them actually direct toward the proteins on the outside of the virus. Lindsay, do you want to add some to that, or?
You're correct, Dr. Bach. So the mRNA vaccines that are out right now actually are directed to make antibodies against the spike protein, which is on the outside of the virus. So any of those small genetic details that may be, or differences between the viruses that it would attack, or you'd make antibodies to attack the virus no matter which one it was.
Jody, you had another question as well, I think.
Yes, I did. Thank you.
Yep.
So the second question, since contract tracing has been out for a while now through the state, are there specific statistics available where people are getting exposed? So are 20% of our population getting exposed in the businesses and 20% of the bars or anything like that to possibly help people understand where they're getting the virus?
Yeah.
So we have looked at that across the state as a whole, and we've also looked at it by region and shared that information with local elected officials and local public health officials. Certain things come up to the top of the list each time. Many times it is related to parties or gatherings that we have in our own home. It's celebrations like birthdays or weddings. It's related to individuals at funerals, unfortunately. We also see this somewhat in the bars and occasionally with restaurants and gyms, but it really has been a lot of those private parties and even, unfortunately, churches where we have seen a lot of outbreaks.
Lindsay, did you want to chime in? No. That was quick. I do. I will just say this. I mean, we still are working on tracings, but one thing that we, whether it's through our official efforts or through just anecdotal stories, both, I mean, the one common denominator is it is occurring where we let our guard down. It just so happens to be what you say is when we're around people we know well, maybe there's more of an assumption to just kind of, you're closer than 6 feet and you drop your mask because I trust you that you're not and you trust me. And so we always kind of look at and then extrapolate that out and just say it's just happening a lot more where there are smaller gatherings where you let your guard down in every county. And that's why we're just appealing to, especially during the holiday season when we all want to get together with our families. So just make that appeal again.
Abdul Hakim Shabazz, Indy Politics.
Abdul, how are you?
Doing fine, Governor. Good to see you, Governor. Good to see you too, Dr. Boggs. Love the beard, by the way. Keep it.
Don't get used to it. I've been told the same.
2 questions. Number one, Governor Pritzker, your colleague over in Illinois, just had a news conference saying that shipments of Pfizer vaccines have been cut in half from 8 to 9 million to about 4.3 million. And so that's going to sort of impact Illinois. One of you guys have had some of the similar situations here like that in Indiana. And number 2, Dr. Boggs, when do you think teachers might be eligible for the vaccination? I know it's kind of hard to sort of figure out right now, but any idea when they may be on that list or what month they might be?
Sorry, Lindsay. Well, no, go ahead. Go ahead.
I'll let Lindsay talk about what the team learned about with regards to doses. But I will say, just like Dr. Weaver has already reiterated, and that is that we are really looking forward to the ACIP recommendations and the conversation that comes out around this weekend about recommendations for those 1B, 1C groups. And certainly teachers would be a part of critical infrastructure and will be a consideration in that. But at this point, as you can see, this is why we don't release the number of doses, because it can change day by day and week by week. Lindsay, do you want to comment on that?
Yeah, so we did find out this morning that we were going to get a reduced number of vaccines than what we are planning on for next week. I will say that our hospitals have been incredible partners, and I have a very large, nimble, wonderful team behind me. So we were very quickly able to crunch the numbers and make sure that anybody who is already currently scheduled for next week will be able to get their vaccine and make adjustments as needed. Whenever I finish my calls with the hospitals, we always end with, this could change tomorrow, this can change next minute. So they are prepared and we are prepared.
Yeah, and I would just say, Abdul, I mean, just to underscore, we're making decisions on an hourly, daily, weekly basis. And so we're of that mindset that every week we'll play the hand we're dealt. And we have the structure, the infrastructure in place to make sure that we're not spilling or wasting, as I said earlier, resources, life-saving resources. But Abdul, to your point, I've received about 100 letters from various groups making the case that they should be prioritized. And I think 6.7 million Hoosiers should be prioritized. And we'll get to the folks who are on the front lines, the most high risk, and make sure we go through the process with obviously the understanding of the volume that we have to work with on a daily, weekly basis.
Brock with WFIU.
Afternoon, Brock.
Good afternoon, Governor. I have 2 questions, one for you and one for Dr. Box. I'll start off with you, Dr. Box. I was looking at the dashboard today, and there was a significant jump in the number of non-COVID ICU beds that were occupied, which brought the overall total of ICU beds available across the state to around 11%. It was about a 12% jump. What was behind that? Was that just a reporting error, or what was behind that?
We ask our hospitals to report to us any ICU bed that is occupied by a COVID patient or a COVID suspected patient, but we don't ask them to report to us who is taking up those other beds. So it would be hard for me without going to each individual hospital and asking, especially those hospitals where they have seen a significant increase, to predict why that was.
Okay, thanks. And then for Governor Holcomb, I was just curious whether you would support, or whether you do support, a second federal stimulus. If so, what should be included in that? A lot of experts I've spoken with said that it's hard for state and local governments without additional funds coming in to be able to make the sort of closures or implement sort of restrictions that might help mitigate the spread. Just wanted to see where you stood on that.
Yeah, I would, and we've been in constant communication with our representatives in Washington as they negotiate their way through this. Obviously, we're in, as you just heard from the revenue forecast, we're in relatively stronger shape than some around the country in terms of your question about state and local governments. So our state is on and bouncing back and on a strong foundation. That has to do with being very prudent and very responsible, making sure that we had savings for a rainy day, making sure we had the ability to go further if nothing passed and continue to do the testing and the tracing. And that's why, building up a savings account or reserves is critically important. It was a year ago and it is today. I have talked about further assistance for those who are still unemployed. The good news is, in the state of Indiana, we continue to see companies grow and expand here and create new job opportunities. We know that we've still got to skill up folks, so that workforce development program is critically important. It's not rhetorical, it's real. So the good news is we've got the jobs, we've got the people, we've got the resources to skill people up, and the key is to make sure we're all doing that and we all have a stake in that. So anything that can help on that front. Obviously, in every conversation I've had, I've talked about our hospitality sector, our restaurants, our small businesses that are just barely holding on with both hands. Through no fault of their own other than this pandemic has washed upon their doorstep. And so we'll continue to lean into those and just to generally answer your question, yes, I've been supportive of a second stimulus. And as I said earlier today, hopefully it's an early Christmas present to those who are in desperate need of one. I will clean up something because I don't know if you and Dr. Weaver gave me the look, but I said 6.7 million Hoosiers should be prioritized. They should, but obviously we're not talking about the 18 years or younger folks right now.
Down to 16,
so I'm not trying to be unsafe.
16 and above.
Yes. I'm not trying to be unsafe about this, but their day will come too as soon as you said, the FDA, et cetera, CDC are making these recommendations, and we get those, as Lindsay said, on a regular basis. So we're anxious about that. Rachel.
Eric with WIBC.
Afternoon, Eric.
Afternoon, Governor. I have a couple of questions on vaccines, and so I think they're probably both for Dr. Weaver. I wonder if you could elaborate a little bit on the hows and whys of planning the next tranches of who gets the vaccine. If I'm understanding it correctly, it's not just whatever the CDC says, we're making our own decisions. So what's the timeline for setting that queue, and what are you looking at to do so?
Yeah.
Yeah, so the Advisory Committee for Immunization Practices makes their recommendations, which we, of course, take as advisory to Indiana. In addition, as mentioned before, we have our own Indiana Vaccine Advisory Committee that looks at the data from the vaccines and also talks about the ethical framework about how we would allocate. There is lots of information that goes into making those decisions. One, how much vaccine do we have? And that lets us know how big of a bucket can we open it up to. What is the safety and efficacy? Some vaccines may be better to give to, our older vulnerable populations, and some may be better for our younger, more healthy populations. Things that they take into consideration as well is what is your risk of exposure? How much are you need to be out and about before work in order to be exposed? What's your risk of giving it to others, especially those who are vulnerable? And a good example is our long-term care staff, and that's why we feel like it's so important for them to get vaccinated right now. And then also your risk at developing severe disease, and would the vaccine help prevent our hospitalizations and our deaths? So you have to take all of those things into account before you make those next decisions. And there are several layers of people and recommendations that we take as advice for that.
I think you had another question, Eric.
I did, yeah. I'll take 1A on that just to ask again about the timeline on when those decisions will be made. But my other question, which you unexpectedly segued into, Moderna, we're hoping is coming. There are other vaccines in the pipeline. how do we make the decision on which vaccines go where? Do people get a choice of, oh, I like the looks of the Moderna trial, I want that one, or AstraZeneca doesn't look like it's effective enough to suit me, I want to go someplace that has Pfizer?
Does this? I didn't ask him to ask this question, Lindsay. Sounds familiar. Two Erics.
Yeah. So timeline, first of all, we are very focused on making sure our frontline healthcare staff and personnel across the state get vaccinated right now. As I've mentioned before, we believe we have over 400,000 of those, so we're very focused on that. And timeline for directing where we go next, we hope will be here in the next couple of weeks as we await the advice from the ACIP Council. So I assure you, as we know more and as we know what to expect, because I think that is a good segue. We have Moderna coming next week, and when people go to get their vaccine right now, it won't be a choice whether, I want Pfizer or I want Moderna. They're very, very close in their safety and efficacy, and so they're equal in that way. It's just important that if you are one of those people who are eligible to get the vaccine right now, that you remember which one you got to assure that you get it. We're, of course, collecting that data on the back end, but it's important for us to know as well, because if you get Moderna now, you need Moderna later. But then as the other vaccines come out, there will be recommendations about who they are best for. For example, Pfizer is 16 and up, and Moderna may be recommended for 18 and up. So there will be small variances that we need to make sure to communicate to our frontline providers who are going to be providing these vaccines, and that we communicate that properly to the populations who will be receiving them.
And then, Lindsay, you might just touch on, he didn't ask this specifically, but there's also the contractual or the relationship of how it is distributed to where. So Moderna could be to long-term care centers or nursing homes, whereas Pfizer may be routed to a different destination.
Right. So based on how difficult it is to handle the vaccine, for example, as you know, Pfizer is ultra cold, so that has been distributed to hospitals right now. We are going to be allocating Moderna for our long-term care plan with CVS and Walgreens, so that's what they will be bringing into our long-term care facilities. And then we're going to have to see, what are the expectations, and again, how much are we going to get to the other vaccines that are in the pipeline.
Thank you.
Kathy with the Ferdinand News.
Afternoon, Kathy.
Good afternoon. Eric kind of just asked my question, but I'm going to change it a little bit from what Dr. Weaver just said. But first, I want to tell you guys are doing a wonderful job. I know how hard this has to be and how we all throw these crazy questions at you and how difficult. And so I think the whole team is doing an excellent job from my perspective. But Dr. Weaver, I had read that the Moderna vaccine isn't as effective for 65 and older as the Pfizer. So you just said that's what they're going to be giving at CVS and wherever for long-term care facilities. So I'm curious about that. And with the information that comes in with each of these kinds of all the different ones that are coming out, will there be those kind of variances that whoever's given them will know?
Yes, we do expect for there to be variances, and we also expect we're going to learn a lot more. With every week and every day that we give it to thousands and thousands and soon millions of people, we're going to learn more about these vaccines and really what the subtle differences are. So you are correct. Based on the initial data from the study where they're at right now, there is a slightly decreased efficacy, they think, in older populations. Given that these vaccines are so similar to each other, it may turn out in the end that they're very similar, but the initial data did show that. So we will continue to monitor the situation, and we'll need to make adjustments if needed.
Yeah, and I might just add, and you might talk, either of you, a little brief second about this, but what we've also noticed through you've put out different surveys or you've acquired different surveys that show people who may be reluctant or hesitant the first round. They still may be high risk. They still may be elderly. In a long-term care center, but they say no, not the first round, but maybe the second or third. But so that also affects not just the volume that we get initially, but the inventory that we have.
Right. Well, first of all, I want to say a lot of vaccines in elderly people are not quite as effective or efficacious, right? So it's not unusual for influenza or other vaccines to maybe not be as effective. But I think the important thing to look at is that when we do initial surveys, and we did that originally kind of our long-term care staff, we saw very low numbers of individuals that were willing to actually say that, yes, we're definitely taking the vaccine. And then a large population of people said, well, I'm not exactly sure about that. And then another percentage of the population that said, I'm not doing it, no matter what.
Yep.
And then when we did some education and kind of went back, and this is what people are finding, is that number of people who say, yes, I'm going to take it goes up. And the expectation is, as Dr. Weaver says, the longer that it's out, the more experience we have with it, the more that we know that this is safe, and the protection that we see for individuals, more people will want to take this.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be Tuesday at 2:30 p.m. Eastern. That's Tuesday next week at 2:30 p.m. Eastern.